Okay. Welcome, everyone. Thank you for joining on short notice. We thought it was very important to have a webinar to discuss the current ongoing COVID-19 situation and what it means for NF patients. So life is pretty much upside down for everyone here, and we are very, very happy and thankful that Professor Legius took the time to explain to you how the situation is, if there are any risks for NF patients, how to behave, and he will also be available for any questions that you might have. Everybody's on mute right now so that we can have no disturbance while Dr. Legius is talking, but you can use the chat function to type in any questions you might have. And in the end, I'm going to open up the floor again for verbal discussions. So welcome and thank you very much, Professor Legius. For those of you who don't know, he's one of the great champions, as I would call him, in the field of NF clinics and science. He's the head of the Center of Human Genetics at the University Hospital in Leuven, and he's also a trained pediatrician. And as far as I'm informed, he has been involved in neurofibromatosis type 1 since his PhD back in 1994. And also he discovered the Legius syndrome, which has many similarities to NF1. So welcome, thank you very much for taking the time. I'm going to give the word now to you.
Okay. Thank you very much for this nice introduction. I received a number of questions from you, and I will start dealing with them from the top to the bottom. So the first question is, if people with neurofibromatosis type 1, type 2, or schwannomatosis are at a specific higher risk for getting COVID-19. So during this corona pandemic, is there a specific risk for patients with neurofibromatosis 1, 2, and schwannomatosis? There I can say that there is no specific risk associated with the neurofibromatosis 1, 2, and schwannomatosis in itself. So people who are healthy and have neurofibromatosis 1, 2, or schwannomatosis are not at a higher risk of getting the disease COVID-19, and they're also not at a higher risk of getting complications from the disease, because as you know, most people who get COVID-19 as a disease will not have severe symptoms. Most people have only minor symptoms compared to a regular flu, and there is a small proportion of people who get really severe symptoms and have to be admitted to the hospital, end up at the intensive care unit, and of those people, a smaller percentage will eventually die. But since this is a very contagious disease, we will have very large number of people who will be infected with this virus, and even if a small percentage of these people die, it will be a large number of people, because it's worldwide present. There are a few exceptions. People who are treated with chemotherapy because of cancer, those people in general have to be more cautious, because we think that they might be more susceptible to COVID-19. But this is not different for patients with NF1, NF2, and schwannomatosis from other patients. There is one specific complication that we see in a very small proportion, a very small percentage of patients with neurofibromatosis type 1. Some patients with neurofibromatosis type 1, adults who smoke cigarettes, some of them have quite a severe effect of smoking in the lung. and they have what we call a interstitial lung disease that is related to smoke, the combination of smoking and neurofibromatosis type 1. And this can already start at a young age, and with a young age, I say 30, 40 years old. And those people might have a higher risk if they get infected with the coronavirus and get the COVID-19 disease. But this is only a very small proportion, and if you stop smoking, it will improve a lot. So please do not smoke. Class, are there any questions regarding this first question?
So far, we haven't received any comments in the chat function about this first question. I think it was clear. Thank you.
Yeah, okay. Then the second question is, are people with high blood pressure at higher risk? This is somewhat a more complicated issue because we know that older people are at increased risk for getting complications of the COVID-19 disease, but older people very frequently have hypertension, very frequently have other diseases. And for me, it is not clear if hypertension in itself, in a young and healthy person, where the hypertension is treated and under control, for me, I don't think that this is a specific risk factor to get complications of COVID-19. So if you are healthy and have a high blood pressure that is well controlled with medication, then I don't think you should be afraid that you are at a higher risk for getting COVID-19 complications. Any questions about this?
Are there any questions? Everybody's on mute. You can hear. You can enter your question in the chat, or unmute your microphone while you ask a question. There's one comment. I'm not sure if it's a question. ACE is there's a question by Federica. ACE is regulating blood pressure. Do you think that virus interaction with ACE can influence blood pressure?
Not that I'm aware of. It uses the ACE receptor to enter the cell. But as far as I know, it is not doing anything with the receptor, just using it to bind to the cell as a way of entering the cell. But as far as I know, it is not altering its function.
There's also one comment by Wouter, but if you are over the age of 50, have it checked yearly. I'm not sure if that's an F-specific question or if it is a question related to COVID-19. So if you can please specify in the chat, I'll be able to forward this question. Also, Edwin says, am I understanding it right that the risks are mostly lung related? So not other tumor like NF2 brain tumor related?
The main problem with COVID-19 is the fact that some people get pneumonia. So they get severe infection of the lung. Usually this
pregnant and I have NF1.
This is something that is cured by the immune system. So the immune system will kill the virus, but in some people the immune system reacts way too hard, and it's the immune system itself that overreacts, that causes a lot of collateral damage to the lungs. So it's a combination of an infection with the virus that is causing a lung infection.
I have NF, and hi, I have a question. I'm pregnant and I have NF1, so is there a higher risk for me?
No. there is
Okay.
no higher risk. No.
Okay,
No.
thank you.
Okay, I hope everybody got the last message of Eric. He was explaining that the pneumonia that is coming along sometimes with COVID-19 it's a combination that there's an infection of the lung and then the immune system of the patient that overreacts and that causes the problems. That was where we were.
And there is a very small percentage of people where the virus can also infect the heart muscle and causing myocarditis, as they say, infection and inflammation of the heart muscle. This is a very small percentage, a very small risk, but that is of course very difficult to treat. But those are exceptions. And there is no reason to believe that infection with the virus will have an effect on the growth of neurofibromas, as we know at the moment.
We also had a question prior to this webinar about NF1 patients with maybe plexiform neurofibromas that are close to the lung or that are affecting, the breathing organs, and yes. Are they at higher risk, or is there something they should watch out for?
I don't think so. I don't think so. Yeah. Because this is a mechanical problem, and usually this mechanical problem is not so severe that it causes a lot of problems. Of course, if you are in such a critical condition that you are just able to breathe enough under normal conditions because of massive amounts of plexiform neurofibromas in your body, then of course with every condition that you get, be it the flu, be it an infection with the coronavirus, that it might be the straw that breaks the camel's back. So it might be the one thing too much, but in general this is not the case.
Okay, thank you very much. There was also some questions about those NF1 patients that are currently taking drugs regularly. Some patients are taking drugs like Avastin. NF2 patients are currently taking MEK inhibitors, or might also be hormones or any kind of drugs for epilepsy, for example. Is there anything known about counter reactions with COVID-19 and prescribed drugs?
Yeah, we don't have any evidence at the moment. It doesn't mean that there is no evidence, but we don't have the evidence at the moment that regularly prescribed drugs have an effect on the course of COVID-19. I don't think that Avastin will have an effect on it because it does not interfere with the immune system, and it does not have any specific effect on lungs. So I'm not so concerned about people who are taking Avastin. People who are treated with chemotherapy, they should of course contact their oncologist to see if they have to take specific measures, because that's something different. If you are taking chemotherapy for cancer or for a benign tumor, then this chemotherapy will have an effect on your white blood cells in many cases. And white blood cells are used as a defense mechanism against viruses. And there, of course, people who are taking chemotherapy for cancer or another for some other benign brain tumors or so, they should contact their oncologist to see what they have to do. And the same is true for people who are using MEK inhibitors.
There was also some confusion about Ibuprofen as a potential risk.
Yeah. Well, Ibuprofen is of course different from paracetamol. paracetamol only has an effect on pain and on fever, while ibuprofen and aspirin and some other drugs from that same group, they have an effect on pain, on fever, but also on inflammation. So it also reduces inflammation and swelling. And because it works on more different systems, it has potentially more side effects than paracetamol. And therefore, people believe that it might be more dangerous because it works on more different systems, but that has not been proven. But I think it's wise if you have fever to take paracetamol instead of ibuprofen in general, because paracetamol has less side effects.
Also, one question that was, do asthma drugs, Montelukast and Seretide, affect my child, my NF1 chance getting COVID-19?
No, it does not affect the chances of having COVID-19, and it does also not affect the severity. And in general, if you look at people who are diagnosed with the disease, most of them are adults. It seems that children can be infected and can have the disease without any obvious symptoms or with minor symptoms. And the risk of complications in children are much lower than in adults. And in adults, it's lower than in older people. But children are relatively spared from the epidemic. That's good.
That's good. Yeah, this was also a question by a mother with 2 children. She doesn't have any possibility then to hand their children over to public care because they have to work. And she was also concerned, is there any, should she take precautions and try to go on sick leave and stay home with the kids, or would you say that's not necessary?
Well, for the health of the children, it is probably not important, because even if they become infected, the chances are very, very high that they will just have a simple symptoms of a common cold or a little bit flu-like, but the chances that they will have complications and have to go to the hospital are very, very low. So that's good news.
There's also one question. Do you have any tips on the social side of NF1 with autism or anxiety disorders, how to deal with isolation or lockdown?
Yes, I think you have to be creative and use all kinds of systems as we are using now. So I think it would be very helpful if the patient organizations themselves come up with ways like this to keep contact with the members of the organization and organize discussion fora, have groups on Facebook and so on, so that people can keep in touch with other people that they know without having to meet them in person. I think that is very important in general, but even more important now, and we have these technological abilities at the moment to do this, so we should really engage in using all the systems that we have, like Skype and Zoom and Facebook and so on and so on.
Definitely. It's also something that NF Patients United is discussing with our members, and we can provide the Zoom system. If you want to set up a call with your national NF community, then we are happy to support you with that. We are doing that in Austria as well. We have just collected a document where we combine all tips and all medical information, but also tips by psychologists, and all that information will be collected in one document that we can happily share with everyone, and you can translate it into your language and provide it for your patient communities. I think, Irene, you wanted to say something? Or,
No, sorry.
Okay, fine. Regarding MEK inhibitors, there's one more question. If I understood well, the advice is to contact the oncologist, right?
Yeah.
To see if the
well, we know that with MEK inhibitors, there is a little bit of an increased risk to get bacterial infections. Usually infections of the skin around the nails, so nail bed infection, but that is completely unrelated to viral infections such as corona, the coronavirus that we have now. But still, I think it's wise to contact the oncologist to see if everything is fine, because we don't have experience at the moment with many people who are taking MEK inhibitors and get infected with the coronavirus now. So we don't know what will happen.
Mm-hmm.
It doesn't mean that it's bad news, but we just don't know.
Yeah. Another question, is there any specific risk if you have to take thyroid hormones? I had a thyroidectomy nearly 3 years ago.
There's no specific risk for thyroid hormones, and you should take them.
Okay.
Don't stop taking them.
Another question, a person who has a child 9 years old with NF1, and the child has hypertension and arterial stenosis, currently on medication to control the hypertension. Is the child considered a risk patient regarding COVID-19?
No risk. Well, the same risk as everybody else.
Yes.
No risk does not exist.
Yeah, no increased risk.
Yeah.
Okay. Yeah, Federica has a question. Do you have any evidence that any of the therapies dedicated to epilepsy can give comorbidity in case of infection?
No, there is no evidence for this. So we think it's all safe.
Maybe at this point, because also what we see now in Europe, there's quite some differences in between European countries of how they are tackling this pandemic and what recommendations are given to the public. Maybe you can run us through your view of how people should behave, what can they do to protect themselves and their families, and maybe you can also talk a little bit about ongoing clinical trials, if you have any information on that.
Yeah, well, I think that the different countries are tackling it in a different way, because what the countries are trying to do is to slow the spread of the virus over the population. They know in every country that the virus is there. They know they cannot get rid of the virus. They cannot just put it outside the country. It's in the country and they have to live with it. But if the virus is spreading very fast through the population, then many people will get ill at the same moment. And that's a problem for the healthcare system. And then, of course, if the healthcare system is overloaded with cases, then you see all kinds of problems because people don't get the proper care they need. And that's why all these regulations are now launched by the different countries. They're all intended to slow down the spread of the virus. They know the virus will spread through the country, but if it goes very slowly, then the healthcare system can keep up with taking care of the people who need intensive care support. And then the intensive care units are not overwhelmed with patients all in the same month. If they can spread it over 2 or 3 months or maybe 4 months, then every month they have sufficient capacity to take care of the patients that get ill in that particular month. And that's the most important thing at the moment. But having said that, we know that for some patients, due to a reason that we don't know, that their body reacts in a strange way to the virus, so that every medical treatment that is given at the moment will not be sufficient. And that's why in every country, people are dying, because we don't have a specific cure for the virus. We cannot kill the virus with drugs. There are a couple of drugs that are now in clinical trials, where people think that if patients are treated with these drugs, that the disease becomes a little bit milder, that it's shorter in time and so on. But there are not sufficient data at the moment to say that drug A is better than drug B, or just giving nothing. So antiviral drugs can be used and will be used, but we don't know how effective they are and if they will be effective enough. We know that they will not be effective enough to prevent people from dying from the disease. Every year also there are people who are dying from the flu, from influenza. We don't have a cure for that. The only thing we can do there is use a vaccination program every season before the winter, so that at least a number of people are protected from becoming ill and the virus is spreading very slowly through the country. Here we don't have a virus, we don't have a vaccination yet, but people hope that it will come in the future, but it will be too late for this outbreak. So people are trying everything. People are also looking at those patients that die or get a very severe infection or complication, to see if they can find out why certain young people do get all these complications. And one of the ideas is that some people might have a kind of genetic predisposition that predisposes them to this unfavorable reaction of their body to the coronavirus. Why this is the case, we don't know. And we don't know either the genetic variants that are responsible for it. This is just an hypothesis that genetic makeup is part of the answer why certain young people have an unfavorable reaction against the COVID-19 disease. And this is now investigated also. It might help explain why certain young people, like people who are 30 years old, perfectly healthy, become ill and then die from the disease, even if they have received all possible treatment that is available at the moment. And this is still a mystery.
Mm-hmm.
But genetic predisposition is probably playing a role, and it, in my opinion, but is now my personal opinion, that the different genetic makeup of people might explain why in some countries the disease is much more severe than in other countries. Of course, you have the healthcare system and the way how the country is dealing with the pandemic. This is also contributing, but to my opinion, also the genetic makeup of people in the country might be part of this puzzle.
Mm-hmm. Another question from Rena, I think that all patient organizations are currently worrying about is In this very unusual situation where most clinics are shut down and they only are dealing with emergencies, so that means for most NF patients, their regular checkups are being postponed for indefinite time. What do you think about this issue, like MRI checkups or just neurological assessments? All this, yeah. What is the strategy, and how long can we continue that way?
Well, luckily in neurofibromatosis type 1, 2, and schwannomatosis, the neurofibromas and schwannomas are slow growing. So for most people, even if they have a neurofibroma or a schwannoma, in most cases, in 95 or maybe more % of the cases, they are slow growing. We know they are there, and we are monitoring the growth to choose at a certain moment the perfect time to interfere with surgery or with drug therapy. So for most cases, it is not a problem if this annual checkup or every 2 years is postponed with a couple of months. Yeah, it would not be wise to just skip the year and don't show up for a control and then go next year or the year after next year. So it would not be wise to just disappear from the follow-up. That would be a real bad thing. Having your follow-up scheduled in 2 or 3 months from now, I don't think that's gonna make a big difference. But skipping, and that's my fear, that people don't show up now, don't take a new appointment, and don't take a new appointment next year. That they will be below the radar, and then something over the years might happen, which is maybe detected at a late stage. So please, if your appointment is cancelled, make sure you take a new appointment and don't skip the year. That's the most important message I can give.
Mm-hmm. And for those patients who maybe have just finished the chemotherapy and they're usually being followed up every 3 or 4 months during an MRI checkup, maybe they had MRI scheduled this week or last week, and now they don't know when they're going to be seen. Should they press for being seen and having their MRI even during the pandemic?
Well,
possible?
they should contact their treating doctor, and it's the treating doctor who can say how important it is to have this checkup now instead of in 2 months from now. We hear in our hospital, we get on a regular basis a list of patients that are scheduled for radiology, and we have to decide as the treating doctor if a certain radiological examination, a scan, MRI scan or whatever, can be postponed with a couple of months, or if we need it right now this week when it was scheduled, or if it can be postponed for 2 weeks or so. So they give us 3 different options. At the moment when it was scheduled, in the coming 2 or 3 weeks, or maybe within 3 months or so. And I think that everybody who has something scheduled in the near future can contact their treating doctor to ask if it's really necessary that I come. If it's necessary, then you have to go. If it's not necessary and can be postponed in a safe way, then it's better not to enter the hospital.
Mm-hmm. We also heard a lot of discussions about wearing a mask, not in the first place to protect yourself, but to protect you from spreading the virus to others when you might not even know that you are carrying the virus. What is your opinion on masks, and should it be something that everybody should follow?
Yeah, that's a good question. The problem was up until very recently that there were no masks available, huh? for the general public. So nothing could be done because there were no masks. At the moment in Belgium, it is not recommended to wear masks, at home or if you go out, for those few reasons that you can go out at the moment. I think the most important thing is to avoid contact with a large number of people. Normally, we do not realize in regular life how many people we meet, how many people went through the same door as we went through, touching the same door handle every day. But if you limit the number of people that you interfere with every day, that's the most important thing. Wearing a mask on top of that, I think is if you don't have any symptoms and if you're not working in a hospital, I don't think it's gonna make a big difference.
You mentioned the availability of masks. Now people are building their own or using just a scarf or something.
Yeah.
Is that having some effect or better than nothing?
Some. There are some studies showing that if you just have a surgical mask like this here, that it will not be perfect. This is not good enough if you are working with infected people in the hospital. Then you need better masks. But this does at least something. It limits the risk that you infect someone, but it doesn't eliminate the risk. But if two people are wearing such a mask, then the chances that through saliva and droplets, one of the two will infect the other is reduced. So it will have an effect, but it's not good enough if you're working at the emergency unit or in the hospital in a ward with people who are infected by COVID-19. Then it's not good enough. But it will limit the risks of transmission, but you're not perfectly safe with something like that. I personally, I will not use this at home.
Yeah, I think it's more. Oh, there's
I have a question. It's not a question, a suggestion. The Italian experience is that the recommendation, the general recommendation are that we have to wear this kind of mask to protect other people, because the problem is that although you do not display symptoms, you may be positive. And the problem here in Italy is that infections spread out because of the positive people. Therefore, now the recommendation is, although you do not display symptoms, you have to wear the mask. Here, the epidemiological curve is asymptotic, and we rarely only staying home and wearing the mask. Therefore, the general recommendation is, please stay home first, and if you have to go out, you have to wear the mask in order to assume that you are infective and you don't infect other people. You don't have to infect other people. That's why our cure now is slowing down because of these restrictive rules.
Yeah, it will certainly help, and it's up to the country to decide if this is relevant at that particular moment during the epidemic. But in Belgium, we did not have sufficient masks available to provide for the whole population in the country. And so all medical masks that were available were all restricted to be used in healthcare.
Federica, maybe you can tell us what kind of masks are people wearing now in Italy?
In Italy, we got from China mask, especially here in Padova. We receive 300,000 masks for each family. But otherwise, alternatively, the people receive masks from industry that convert the production to mask. Therefore, we react quickly on February when the school closed. Immediately the mask disappeared, and therefore we wait 1 week at home, the mask, and then we went out to buy food with the mask that we received from China first, and and the mask that we received from the industry here. So immediately the industry helps us, but the curve was already going up. Therefore, in some town, the situation is still dramatic, and the general message is stay at home, especially old people or immunodepressed people. Stay at home and protect other people that are vulnerable.
Yeah. Wash your hands, don't shake hands.
Absolutely.
Don't give kisses, respect the 1.5 meters social distance, and so on and so on. Yeah.
Social distance, exactly. In fact, we cannot go out. I mean, in our small garden, for us, it's absolutely forbidden to speak with our people close to us, a neighbor, right? because otherwise the transmission is possible, especially because the doubt is that the virus do not go through droplets, but also through aerosol. Therefore, the virus maybe is traveling longer. That means that 1.5 meters of distance is not enough, maybe 2 meters for no more than 15 minutes. That's what biologists explain us.
Yeah.
I think it's also important to mention that you can wear those masks only one time, and then it doesn't protect you or others anymore. Once your own viral load is on the outside of the mask because you touched it or because moisture went through the mask, then it's no protection for others. I think some masks, it's able to reuse some masks by washing them and disinfecting them, but
is it useful to clean the thing you buy at the supermarket at home? So something like cheese, it's packaging in plastic, so I have to clean it at home, or it's not necessary?
I think they are disposable. Most masks you can use only one day, and then you have to throw them away. If they are those expensive masks that they use here in the hospital, these FFP2 and FFP3 masks, if they are clean, they are collected by the cleaning service of the hospital. They are and they are disinfected overnight, and then they can be reused again the next day. But I don't know if you can do that at home.
There's also one question that somebody has seen on TV, that they put a mask in an oven for 15 minutes and that should kill or disinfect the mask. Is that true?
That might also kill the mask.
Depending on the temperature, right? Okay. And also one question, how effective is chloroquine and azithromycin protocol for protection against this virus? If it's effective, as the media displays as it is, how come there is still so many deaths in countries all around the world?
We just don't know. We just don't know. There might be, if they have an effect, it's a relatively minor effect, but this minor effect is better than nothing. That's where we are at the moment. And also here, chloroquine or hydroxychloroquine is something that is very much in demand at the moment. And it's not very easy to secure a supply of these drugs for everybody in a country who gets the disease. So at this moment, we get shortage everywhere. Masks, protective clothes, certain drugs are in shortage, even specific drugs that are used at the intensive care units to keep people asleep when they are under mechanical ventilation, and so on and so on. Consumables that are used in testing for the virus, there is a shortage of it, and so on.
Maybe that's also maybe something that has been discussed a lot, the accuracy of test methods. There are obviously different test methods in place, and people are wondering why not more testing is happening. In some countries, only those that get rushed to the hospital, that are in emergency care, are being tested, and others are just advised to stay at home and they are never being tested. So we don't really know how many people are infected at this moment. Can you maybe talk a little bit about the tests that are available at the moment, or is there a need for better tests?
Well, I think that the tests that are available at the moment that are trying to detect the viral RNA, because the virus in the middle has an RNA molecule, and it's this RNA molecule that contains the code of the different proteins that are needed to assemble the virus. And it's this viral RNA that is very specific. And if they take a swab from the nasopharynx through the nose till the throat, then they collect all these secretions. And in this secreted mucus, there is a lot of viral RNA present. This viral RNA is extracted from the mucus and then detected in a specific way through PCR. And this is a very accurate way of diagnosing an acute infection of COVID, of the coronavirus that is causing the COVID-19 disease. This is a good test, but because many people in many countries are using this test, it's very difficult for the companies who provide the reagents to do the test to keep up producing all these reagents for all these different countries that all want to test for the RNA, the presence of the RNA in the mucus of the nasopharynx. And even sometimes these swabs that are used to scrape the mucus, there is shortage of those because there is such a worldwide demand for these products that they do not always get at the right place to test. And that's why in certain countries they say, okay, this is the number of tests we can do every day. That's the maximum amount we can at this moment because of these practical reasons, not because there is no test possible. There are tests, and in every lab that is specialized in detecting viruses, they can do these tests, but there is a shortage of swabs, of reagents to extract the RNA, of reagents to detect the RNA. It's because of this shortage that countries decide to test only in very specific conditions where the information is really needed. If you are at home with flu-like symptoms, then it doesn't matter much if this is influenza or a coronavirus, because you will recover anyway. And if you stay at home, and if people who are sick now in these days consider themselves as being potentially infected with this virus, they can take the necessary precautions not to contaminate or to infect many other people. And that's the reason why there is not much more testing done. Of course, we don't know how many people were infected and are recovered, but at this moment, those that are recovered, it is not so important to know this. It's important to know this afterwards to see and to learn a lot from this epidemic, but it's not that relevant to treat people. They're also working on a test to detect the antibodies that the body is making to eliminate the virus. And these antibodies can be detected. But again, this is a new test because this virus was not present before. So these tests had to be developed from scratch. And there are no millions and millions of kits available at the moment to distribute over the world so that everybody can be tested to see if they have antibodies against the disease, were already infected and are now safe, as we hope. But these things will all come. There are also these rapid tests that try to detect the virus in the mucus with an antibody, but those tests are not as accurate as those that detect the viral RNA with the PCR test. And they might be false positive or false negative, and I don't know how relevant they are at the moment. And every hospital and every country has to decide for themselves if they will use those tests or not.
Mm-hmm. There's another question. How certain are we of the origin of COVID-19, where it came from? Was this jump from animals to humans inevitable?
I don't know. The only thing we know it is that it came from China. And then we have to believe what the Chinese tell us.
That's true. I have a follow-up question for the testing. Iceland, I believe, have started to test representative groups of their population to get a better idea of how far the virus already spread, because I think this would give a lot more insight about the future strategy of tackling the virus. Is that something that you think should be implemented by other countries as well? Of course, they have a much smaller population and don't need as many tests. They have, I think, 300,000 something people in Iceland. Yeah. But the basic principle sounds reasonable.
Oh, yes. And all these things will happen in the near future. As soon as more tests are available, people will do more tests. But now in Belgium, we have a population of 11 million. If we have to test all of these 11 million in a couple of months, that's a lot of tests every day. This is virtually impossible to do. And in a country with 20 million, 70 million, 100 million people, it's going to be very, very difficult from the practical point to test all of these people in 3 or 4 months. And I don't think that is at this moment reasonable to do.
One other question from myself is, nowadays we live in, the age of the internet, and that gave rise to a lot of people spreading conspiracy theories. How can the people with an F protect themselves from fake news and all these influencers that are putting out false information? Are there some recommendations that you could give to the NF community about that issue?
I think people should listen to the national guidelines. In every country, there is a steering committee that consists of medical doctors, of scientists that are coming together, epidemiologists who study the spread of diseases in populations and so on, and their recommendations should be followed. And it's different from one country to another because every country is different in a different stage of the epidemic. And I think you should listen to those people. That's the only thing I'm doing.
It's also something that we in Europe as NF Patients United are now collecting information, and every member organization will be advised to provide a collection of links for the official statements released by our government, so that we know where to get the first-hand information and not listen to maybe doubtful sources on the internet. That would also be my advice. So are there any more questions? We are almost done with our time. Thank you everyone for all the questions so far. And of course, thank you, Eric, for addressing all the questions. If there's no further questions, then I would also like to mention that we are going to provide the recording of this webinar on our NFPU YouTube channel. And we will invite all our members to do a translation with the subtitles in your national language, so that those of you of your community who can't speak English can listen to the webinar. So now I'm getting a lot of thank yous that I forward to you directly. Eric, thank you very much for taking 1 hour and to speak about this issue. I'm sure same in Belgium, a lot of people are very insecure right now in this situation, these difficult times. So let's hope that the measures will be effective and we will see an improvement. Yes. Yes, and a lot of thank yous again. Okay, great. Then I'll webinar. Thank you very much, Eric. Thank you everyone for participating. Stay safe, stay at home. That's our message.
Okay,
Goodbye.
that's my message too. Bye.
Bye-bye.